Hi, everybody. My name is Dennis Schiraldi, and I'm getting a great opportunity to sit down with Dr. Lawrence Schmetterer of Schmetterer MD in Youngstown, Ohio. He is a vascular surgeon, and we wanted to get together to briefly discuss telehealth, telemedicine in the wake of the most recent COVID-19 pandemic. Dr. Schmetterer, how are you today?
Good, Dennis. How are you doing?
I'm doing really well. Consider all things considered, first and foremost, safety for you and your family and all the frontline healthcare workers that are out there, and not just them, the people working in the grocery stores and all these other positions that are going to be out there dealing with the public day to day. If you could for just a moment, why don't you just share a little bit about your background being a vascular surgeon?
Thanks, Dennis. First and foremost, I'm a board certified cardiothoracic surgeon. So I've done everything from heart surgery to a lot of lung cancer surgery, and of course, the full spectrum of vascular surgery. My practice started in Northeast Ohio here in Youngstown in 1992, straight out of training on the West Coast in Southern California. Undergraduate before that, Duke University, and then I come from the Chicago suburbs of Highland Park. My practice is currently about 70% vascular and 30% thoracic surgery. Thoracic surgery is predominantly lung cancer and then treating infections in the chest. Vascular surgery is everything from the carotid arteries in the neck to the blood vessels all the way down to the toes for limb salvage and dialysis access, and aortic surgery and open vascular surgery and endovascular surgery, pretty much everything.
Oh, that's great to hear. Now, my background, I've got 20 years of healthcare marketing and sales experience. I've worked with GE Healthcare as a marketing executive in their radiology IT department. And now I own my own marketing agency in Youngstown, Ohio, and I work with a number of healthcare providers. It was important for me, as we were talking yesterday, a little bit behind the scenes. We're not going to get as in-depth as we were with the coronavirus discussion that we had. But it was important for me to want to have this conversation as well, somewhat of a PSA for people to get understanding of some of the COVID-19 discussion from a healthcare perspective, from a healthcare professional. And then also, in addition to that, jumping in so people understand that there are telemedicine solutions. So the first question I have is, how's COVID-19 impacting the day-to-day healthcare environment? People are still having health issues that extend beyond that and need attending to. How's this all impacting it?
Well, frankly, Dennis, it couldn't be any bigger. Since this started rolling out about a month ago, the first death from COVID in the United States was only 1 month ago. And look at how far we've come in just 4 weeks. What we're seeing in the hospital is a lot of patients with respiratory problems that, because of the delay in the testing, they're what you call a rule out, which means you don't know if they have it or not. And unfortunately, that means for everyone's protection, they have to be fully insulated against any transmission of infection, which involves a lot of personal protective equipment, which I'm sure you've heard in the news is expensive and hard to allocate. So a lot of equipment is being used because there are so many patients who, frankly, we don't know if they're positive or not. And then there's a handful of patients who have COVID who are in dire straits, and we have lost some from our community recently. It's important to realize that we're going to be in this for a while, as was announced yesterday by the president. Looks like end of April for social distancing, and that goes along with some common sense understanding of this disease. The incubation period is anywhere from 1 to 12 days, which means you can have it and not know it for almost 2 weeks. Once you have it, if you have it, and you start having symptoms, the course of disease can be anywhere from 2 to 8 weeks. So in 2 weeks, you can get over the sniffles, or if it goes bad, the total course before all is said and done can be 8 weeks. That said, if social distancing worked, and everybody stayed put and didn't touch anyone else, effective when this started, which was about 2 weeks ago or a little bit less. That means everybody who had it at that time, you're not going to know how that all turned out for 1 plus maybe 8 weeks. Hence, end of April is not too soon to say, we have to wait. Or I should say, it's not too long to wait to find out what's going to happen. We should see a change in the upward swing of the curve by the end of April, but I wouldn't look to see it much before then. So people just have to settle in and follow the precautions. As far as what we're doing, precautions in the hospital is effective 2 weeks ago, we basically stopped the routine outpatient visits and started cutting back on surgery. Effective 1 week ago, we pretty much shut down the operating rooms except for emergencies or very serious problems that shouldn't wait. Over the past few days, I've started thinking about my practice and how I can take care of my patients. They call, they want to come in, they want to be seen, they want follow-ups, they want to know how they're doing. They've had big workups for vascular and thoracic problems. They want to know what that spot looks like on the x-ray. They want to know where the blockages are in their arteries. And they want to come in, they want to talk. They want to be figured out and they want to be scheduled for surgery. So what I started doing today in my practice is I initiated telemedicine, which for my patient population, most of them are good with the telephone. Not a lot of them can go online and click on links and download apps and get connected with audio and video. That's a lot to ask, but they're all happy to answer the phone and not have to drive to the hospital and go into the clinic and sit and wait and be around other people. And I can spare them from that. So I saw about a dozen folks today via telemedicine, basically talking to them on their phone, going over their studies, explaining what's going on, coming up with a plan of action, in some case scheduling more testing. In other cases, telling them we're going to surgery as soon as this thing settles down. We're going to surgery. I saw a handful of patients today that needed to be seen in person, and we've got precautions in place to avoid contact, to avoid any transmission of disease if it were present. So we did see half a dozen people in person. Of course, everybody who walks in the hospital is having their temperature taken as they walk in, and they're given the once over by a registered nurse who looks at them and just looks for signs of sickness. We don't want sick people walking into the hospital to visit or to go to appointments. That's pretty much where we're at right now.
And typically, and thank you for all that information. I think it's incredibly valuable for people to understand from a healthcare perspective, a healthcare expert's perspective, somebody that's on the front lines doing this on a daily, day-to-day basis. You talk about the telemedicine and the discussion over the phone, or, you obviously have access to Zoom and FaceTime in the event that somebody has the understanding on how to use that. These people that typically that you're seeing, their health is already compromised. So there's a benefit to eliminating the number of office visits that they would potentially lead into, correct?
Absolutely. Just to give you an example, if someone has an abnormal chest x-ray and they get sent to me because they have a spot on the lung. The first visit is a full consult, history, physical, looking at their x-ray, talking to them, scheduling a CAT scan. Next visit, they'll come back, they'll look at the CAT scan, we'll talk about what that shows. We may order a PET scan. We may order pulmonary function testing. We may ask for a pulmonologist to see them. Third visit, put all the things together, and then planning surgery. I think what we can do now is we can eliminate the first two visits, get their workup ready, talk to them, and bring them in for that third visit where we put it all together and establish that one-on-one rapport. So we're not planning an operation with a surgeon that they've never, locked eyes with. And I think that's important, that the patient needs to get an idea and meet their surgeon, and just, you can't show up the day of surgery and operate on someone. That's not right. But I think we can cut out, in many cases, 2/3 of the visits. I was amazed how much ground we were able to cover today talking with my patients, and they were so happy.
Yeah.
Sitting home, waiting for me to call them in their own easy chair, rather than sitting in my waiting room where, frankly, there's no magazines anymore because you don't want them touching anything. The chairs are about 10 feet apart, so they can't sit next to anyone. And it's kind of a lonely situation out there. So I love that the patients can wait at home.
That's awesome news. So everybody, I appreciate you hopping on today for this quick interview. I think that the value of this is going to go a long way. And how can we find your telemedicine appointment? We got your website. We've got phone numbers, right? So the people can go ahead and schedule an appointment.
Absolutely. If anyone needs to get in to see me for any vascular or thoracic problem, all they need to do is call the office, 330-743-3604. You can find me on Facebook at Lawrence Schmetterer Thoracic and Vascular Surgery. You can find my website at www.schmetterermd.com. And wherever you look, you'll find a way to get in touch with our office, and we can take it from there. If you're savvy and you want to go telemedicine on Zoom, we can do that. If you've got a cell phone and you want to do Skype or FaceTime, we can do that. And if it's going to be a telephone, we're happy to do that as well.
That's great, Doc. Thank you so much. We're going to make sure that we put the notes from this interview into our posts across social media, into the email newsletters that we've got, so that all of you out there can find it. Stay safe, stay home, wash your hands, practice good social distancing, right?
Be safe and don't touch anybody.
Doctor's orders, everybody. Thank you.